everyone, welcome. I am Ghali Salahia, an interventional radiology registrar in South Wales. I'll be sharing the outcomes of our project Vivid, which stands for Video Supported Consent for a Visually Aided Informed Decision, with you today. Before I start, I would like to make a short declaration. Bevan Commission Technology Exemplar funds allowed purchasing of dedicated tablets for 5 different interventional radiology procedures for patients to watch in clinic or on the ward. It also allowed a 1-year subscription to those animations online. The procedures included peripheral angiography and angioplasty, endovascular aortic aneurysm repair, EVAR, fistulogram and fistuloplasty, cerebroangiogram, and uterine fibroid embolization. The animation copyrights still belong to Explain My Procedure Limited. Image-guided interventions can be difficult for patients to imagine, resulting in incomplete understanding of interventional radiology procedures such as leg angioplasty. Time constraint and lack of physical IR clinic during COVID pandemic present additional obstacles. We developed and introduced digital animations to support consent and assess the effect on patient understanding. These animations explain the medical, the risks,
benefits, alternatives,
and simply and in a language that patient can understand. They were embedded in patient's journey from referral to procedure. Before the introduction of animations, we assessed reported understanding of the procedure, its benefits, risks, and alternative treatments using this short questionnaire. Total number of patients was 20 in the no animation. Following this, we introduced the animation to the outpatient journey for patients undergoing peripheral angioplasty. The vascular surgeon receives the referral and reviews the patient with imaging. Next, the case is discussed in the vascular NDT with interventional radiologist. Following that, the patient is contacted by the IR virtual clinic, and a letter is sent containing a link to animation, as well as a QR code. Patient attends for pre-admission swab and bloods, and watches animations on video book if they haven't watched it online. Following this, we introduce the animations to the outpatient journey for patients undergoing peripheral angioplasty.
After that,
the vascular surgeon receives the referral and reviews. The link took the patient to their dedicated procedure, which can be watched in multiple languages, including English, Welsh, and Arabic. This is a short clip from the English version of leg angioplasty animation.
This video describes the medical procedures, peripheral angiography and angioplasty. Peripheral angiography is a test used to see narrowings in the leg arteries that may be limiting blood flow, and always precedes angioplasty, which is used to improve blood flow, in order to relieve symptoms of pain on walking, to help a healing ulcer, or a foot with gangrene. Please listen carefully to what is involved. Before your procedure, your doctor may arrange for you to have a CT scan or an ultrasound, tests that provide an initial understanding of the problem. Angiography is a special X-ray of the leg arteries, which shows up narrowings that may be limiting blood flow. First, you will be given an injection of local anesthetic in your groin, before inserting a small tube into the artery at the top of your leg. A liquid dye is injected and X-ray pictures are taken. You lie on a bed during the procedure and are awake, so you can talk to your doctor and your doctor can talk to you. It is important to keep your legs still during the procedure, but if this is difficult for you, your doctor may give you medication to relax, or an anesthetic injection to reduce the discomfort and help you keep still. The angiogram will show whether you need treatment with a bypass operation or angioplasty. Sometimes a combination of treatments are needed. If your doctor recommends angioplasty, then this is usually performed at the same time as the angiogram. Tiny balloons are used to stretch open the narrowings in the leg arteries, and metal stents may be inserted. The decision to do this varies from patient to patient. These procedures are not risk-free. As well as benefits, there are possible complications. You may experience discomfort in the leg as the fine tubes are passed into the arteries, bruising in the leg which will fade, pain lasting a few days which can be controlled with medication, and rarely infection. More serious but uncommon risks include bleeding, allergy to dye, blocking an artery to the foot, kidney failure, and rarely not surviving the procedure. Each of these risks is uncommon, about 1 in 200 to 1 in 100. If one of these uncommon risks turns into a complication, extra procedures may be required, including blood transfusion, surgery to repair a bleeding artery, emergency bypass surgery, limb loss, or kidney dialysis, which is more common in people with kidney disease. Not all procedures are successful. Procedures above the knee have a better outcome than below the knee because the arteries are larger. There is also a later risk that the narrowing can recur, or stents may narrow or block off, requiring repeat procedures. In any medical procedure, the risks need to be outweighed by the benefits. Your doctor has taken this view, and so recommends the procedure in your case. Please ask your doctor about this if you are unclear. The decision to have this procedure is yours. Some people in particular professions or with certain lifestyles or other health problems may attach more significance to particular risks than others. We encourage you to discuss this with your doctor or nurse if you have any concerns. After the procedure, your doctor may press on your leg to prevent bleeding or insert a tiny plug. Your doctor or nurse will see you to explain any tablets you will still need to take and when you can return home. Once you have watched this video, there will be an opportunity to speak to your doctor or nurse. Please ask any questions you may have. You will be asked for your consent to the procedure before it starts. This is another opportunity to ask questions. Angiography is only one way at looking at the blood flow in arteries to your legs. Other approaches include CT scanning, ultrasound, or magnetic resonance imaging. Sometimes a combination of methods are used. Angioplasty is only one way of improving blood flow to your legs. Others include bypass surgery or supervised walking therapy. Your doctor has recommended angioplasty, but if you have any questions about the alternatives, including not having the procedure, please ask. Having a procedure does not mean you should stop your tablets. Please check with your doctor or nurse.
After the introduction of animation, we asked the same questions to 12 different consecutive patients and asked for their feedback. Smaller number in the animation group due to lockdown policies, as the procedure was reserved for patients with critical limb ischemia. Patient understanding in the two groups was compared. The proportions of patients who completely understood the procedure, its benefits, risks, and alternative has increased with significant difference for patients' understanding of the risk and alternative with p-value less than 0.05 as per mid-p exact test. Patients as well as doctors loved it, and here is some of the feedback that we received, including an overall positive impression. In conclusion, use of multilanguage animation explaining angiography and angioplasty is feasible, was associated with improvement in patient understanding before the procedure, and assisted in overcoming obstacles imposed by the current COVID pandemic. Thank you for listening. You can see the animation in more languages by typing this link or scanning this QR code using your phone camera.